All right, team, settle in. It's truly inspiring to think about all 6,000 of you, the heart and soul of the Utah Department of Health and Human Services, tuning in to listen to my remarks today. What a journey it's been since we came together in 2022, forging a unified path to strengthen the well-being of every Utahn. This week, as we celebrate Employee Recognition Week, various teams will be visiting our facilities across the state. And I thought this would be a great opportunity to address you directly regarding the current state and future of the Utah Department of Health and Human Services. Just like a president might give a State of the Union or a governor might give a State of the State address, consider this as our own State of the Agency. When we launched this department, we knew it wouldn't be easy. Integrating two large, vital agencies was a monumental task. Yet look at what we've accomplished together. Our department has changed a lot over the past 3 years and is still changing. Yet through all of this change and yes, challenges, we continue to be guided in everything we do by our goal that all Utahns are healthy and safe. We've been thrown many curveballs in progressing toward that goal, but through our resilience, flexibility, and DHHS values, we continue to make progress one step at a time. While the ground seems to be shifting beneath us and structures that have been in place for years are changing, it's our vision and values that support us through an evolving federal landscape and provide the ongoing resolve to meet the needs of those we serve. Here in Utah, we have something truly special: the best minds, the most compassionate hearts, and a steadfast dedication to the people we serve. I have absolute confidence that together we will not only navigate these external challenges, but emerge stronger and more effective than ever before. Think back to the early days of the merger. Since that time, we streamlined access to crucial services, making it simple for families and individuals to navigate the support they need. Our integrated data systems are now providing a clearer picture of the health and human service landscape, allowing us to target resources more effectively and proactively. In March, our Division of Family Health launched a new website, earlychildhood.utah.gov, which will make it easier for families to access resources that will support the healthy development of their young children. One of the most significant achievements I've witnessed since our merger is the remarkable way you have all embraced collaboration. We've actively worked to break down silos, fostering a spirit of teamwork and shared purpose across divisions. This unified approach is essential as we strive to create a truly integrated and seamless experience for the Utahns who rely on our services. Our priorities are clear and driven by our core mission. We're laser focused on being customer-centered in everything we do. This means putting the needs and experiences of the individuals and families we serve at the forefront of every decision, every policy, and every interaction. For example, over the last 6 months, our rolling average for website experience satisfaction continues to trend in the right direction. In Q3, there was a 75.5% reduction in customers reporting they're unable to accomplish their task and a 23% reduction in customers requesting support. We've expanded access to mental health services across the state, recognizing the critical role mental well-being plays in overall health. Our public health teams have been tireless in their efforts to keep our communities safe and informed, adapting to evolving challenges with resilience and expertise. Consider the strides we've made in supporting vulnerable populations. Our child and family services have been strengthened, focusing on prevention and reunification. We've enhanced our programs for individuals with disabilities and our aging population, ensuring they receive the dignity and care they deserve. And let's not forget the incredible work being done in our healthcare programs, ensuring access to quality medical care for countless Utahns across our newest operation, providing health care to individuals incarcerated in Utah's prisons. From Medicaid expansion to innovative healthcare delivery models, your dedication is making a tangible difference in people's lives every single day. Our big moments from the past 10 months include celebrating 50 years of service by the Women, Infants, and Children Nutrition Program, known as WIC, which serves tens of thousands of Utahns each year. Disability Law Center settlement completion represented the successful completion of a 5-year settlement agreement with the Disability Law Center. The agreement, stemming from the Christensen v. Minor lawsuit, focused on improving access for people with intellectual and developmental disabilities to live independently in their communities rather than in institutions. Adults on Medicaid now have access to dental services. Important accreditation that recognizes our commitment to providing high-quality services to the public. Prison health accreditation, public health accreditation, accreditation of the medical examiner, and certification of our Medicaid payment system called PRISM. These are just a few highlights, and each one represents hours of your hard work, your compassion, and your unwavering commitment. You've embraced change, collaborated across divisions, and consistently gone above and beyond. I'm deeply grateful for each and every one of you. Now, as we look to the horizon, we do so with both pride in our accomplishments and a clear understanding of the evolving landscape. Significant changes are underway at the federal level, and these shifts will undoubtedly present both challenges and opportunities for our work. We must be prepared to adapt, to innovate, and to continue to focus on the health and human service needs of Utahns. This may require us to find new ways of operating, to forge stronger partnerships at the local level, and to be even more creative in our problem solving. However, I'm confident that the foundation we've built together, a foundation of collaboration, innovation, and unwavering dedication, will serve us well. Our unified structure allows us to be more agile and responsive to changing circumstances. Our shared mission will continue to guide our decisions and our actions. I want to take a moment to validate the incredible work each one of you does day in and day out. You are the backbone of this agency. Your dedication, empathy, and expertise are what make a real difference in the lives of Utahns. Please know that your contributions are seen, valued, and deeply appreciated. Our approach is firmly aligned with our vision, values, and principles: accountability, connection, efficacy, empathy, equity, impact, innovation, and support. These aren't just words on a page. They are the tenets that shape our culture and drive our actions. And your guiding principles remind us what's most important. Staff are our most important stakeholders. We respect everyone as the individuals and the perspectives they bring. We communicate the why. We are leaders, learners, and problem solvers, and we understand that the road to success can be paved with how we navigate our challenges. This brings me to the broader context of our work. Governor Cox has set an ambitious and vital goal to create a thriving Utah where every individual can fully engage in the pursuit of happiness. We're calling this goal Built Here, and the Department of Health and Human Services is at the very hub of making this vision a reality. We are the central point of connection and support for so many Utahns as they navigate life's challenges and strive for optimal well-being. From ensuring access to vital health care and providing support for vulnerable populations to promoting healthy lifestyles and fostering strong communities, our work touches every aspect of thriving Utah. Our focus as a department can be best understood through our strategic priorities, which we are working toward in partnership with the executive leaders throughout the department. These priorities include employee wellness, in which we're looking at ways to improve the use of Guarding Mind survey, policies to reduce overtime hours, and maximizing the value of in-person office days by ensuring they're purposeful, focused, and strategically planned for collaboration and team engagement. We're also looking at what it means to be DHHS by improving data sharing, mitigating risks, improving workflows, creating a unified brand and sense of belonging in the department, and promoting health and safety outcomes for all Utahns. Our third priority is comprehensive system design, or the way we do business, such as standardizing investigations, working with behaviorally complex youth, and developing our system of prevention so people don't end up in deep-end services. Our fourth area is the governor's priorities. If you want to be successful in any organization, it's important to pay attention to the priorities at the top and to find ways to align your work and effort to these priorities. Governor Cox has signaled a need for the recruitment of additional foster families, increasing access to home and community-based service settings for youth in DCFS or JJYS, supporting older adults, which we're seeing right now with the WISE initiative, and health integration with partners like the One Utah Health Collaborative, which is on a mission to create a system of care that helps all Utahns. We also wanted to address gaps to prevent homelessness for clients who move out of DHHS services and as always, strive to increase our efficiency and effectiveness to achieve important outcomes for those we serve. We expect to hear more efficiency initiatives coming soon. This framework helps us strategically allocate our resources and efforts to maximize our impact. Finally, I want to highlight our commitment to leadership development and training. We recognize that our greatest asset is you, the employees at this amazing department. We've made significant strides in improving the orientation process for new employees and supervisors, ensuring they feel supported and equipped from day one. Furthermore, we've developed targeted training modules to foster the professional growth of our current supervisors, empowering them to lead effectively and inspire their teams. Our team at the Office of Leadership Development and Training launched the first of 6 modules for a leadership competency series in 2024. All supervisors will be required to take these courses over the next year. The series will cover the following topics: leadership foundations, what it means to be a DHHS leader, building relationships and fostering trust, difficult conversations and giving feedback, ownership and accountability between self and others, delegating and empowering others, and time and priority management. We're building something truly significant here. The merger has laid the foundation for a more integrated, efficient, and impactful agency. The manifestation of our vision is evident in the many accomplishments we've achieved since coming together. The opportunities ahead are significant. We have the chance to further integrate our services, to leverage technology in new and impactful ways, and to address the root causes of health and social challenges in our communities. We can continue to build a system that is truly person-centered, equitable, and effective. Over the coming months, we will be engaging in thoughtful discussions about how changes occurring federally will impact our work and how we can best position ourselves to continue serving Utah effectively. Your input, your expertise, and your dedication will be more critical than ever. I'm excited about the future of the Utah Department of Health and Human Services. We have a clear vision, a strong foundation built on collaboration and shared values, and most importantly, we have you, a dedicated and talented team committed to serving the people of Utah. Let's embrace the future with the same spirit of collaboration and determination that has brought us this far. Let us continue to learn from each other, to support one another, and to remain focused on our shared goal, to empower individuals, strengthen families, and build healthier communities across Utah. As Helen Keller once said, alone we can do so little. Together we can do so much. Thank you from the bottom of my heart for your incredible work. The state of our agency is strong because of you. Now let's move forward together, ready to meet whatever the future holds. Thank you.